Hey guys, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Chapter 66. Today we're gonna talk about lung cancer as a mass on chest X-ray and CAT scan. Lung cancer manifested as mass on chest radiology. Let's go. Mass is defined as more than 3 cm in size in longest diameter. We see two large masses in right upper lobe and left lower lobe. Let's go. First case, the old man. What do we see on his right upper lobe? 4 cm mass. Slightly thickened minor fissure and obliteration or bulging of right paratracheal stripe and 4R lymph node enlargement. On the second image, coronal lung window setting CT film, we see 4 cm mass with many spiculations and many lobulations, usual feature of lung cancer, and minimal thickening of minor fissure and another tiny nodule in upper superior portion of right upper lobe. How about the axial contrast enhanced CT? The mass is in contact with the visceral pleura, suggesting pleural involvement and bilateral mediastinal lymph node enlargement, suggesting N3 staging. Adenocarcinoma. What about this second case? Old man with mass more than 4 cm in size, a mass in right upper lobe, broad based on the pleural side, apex side. On lateral film, we can confirm the mass location in right upper lobe apical segment, broad base. Coronal contrast enhanced CT shows 6 cm mass of T3 staging and diffuse broad involvement of pleura, pleural invasion, staging of T2. So this case shows T3 staging of right upper lobe lung cancer, squamous cell carcinoma. How about the third case, old man? In his right upper lung zone, large, fist-sized mass, 8 cm in size, so already T4 staging. More than 7 cm is T4 staging. And below that mass, we see the minor fissure. On the lateral film, we see the location of apical posterior segment in the right upper lobe, already invading the major fissure. Axial CAT scan shows us no contrast enhancement in the central portion of the mass and also no uptake. No uptake in the central portion of the mass in PET-CT scan. This means the central portion of the tumor is mainly necrotic non-viable tissue. Fourth, lifelong heavy smoker, old man. We see triple findings due to smoking, lifelong smoking. First, lung cancer in right upper lobe, and second, severe emphysema all through the lung, especially upper lobes. Third, interstitial lung disease, honeycomb lung, and also with additional phrenic nerve invasion and pleural effusion. The axial contrast enhanced CT confirms us that the tumor is in right upper lobe location in large size with pleural effusion. How about this fifth case? The arrow indicates a mass slightly bigger than 3 cm in diameter just below the minor fissure. Also, we can find out the right middle lobe location of this tumor on lateral film. Just below the minor fissure, there is a mass. At the first image, the mass is 4 cm in size with many speculations and lobulating contour with several pleural nodules suggesting pleural metastasis. And second coronal image shows us the mass is invading minor fissure and also embedded into the right upper lobe. And we see another interesting findings of accessory fissure below the mass, below the major fissure vertical line. What about the sixth case? We see the right pleural effusion, obscuration of right diaphragm, and right protracheal line obliteration with bulging contours suggesting 4R lymph node enlargement, and some faint outer line of mass shadow. The arrow indicates the mass shadow. On the lateral film, we can find out the mass in the right middle lobe. Now these CAT scan images show us where the tumor is and what happened to the right lung field. The mass is in right middle lobe, 4.5 cm in length, and smaller arrows indicate pleural nodules, pleural metastasis, and malignant right pleural effusion. The coronal lung window setting image shows us right middle lobe mass with pleural invasion, pleural nodularities suggesting confirming pleural metastasis. Seventh, this old man's frontal radiograph shows us large mass overriding right hemidiaphragm medial side. And also we see the preserved right heart border. These findings all indicate that the mass is in lung, not abdomen, and right lower lobe, not in right middle lobe. We can confirm the findings with this CAT scan image that the mass is in right lower lobe location with central necrosis, squamous cell carcinoma. I'll give you a brief explanation about thoracoabdominal sign, which Dr. Felsen suggested long before. Please look at the lateral film. The red line means diaphragm line, hemidiaphragm line, that the mass is overriding or the diaphragm is dissecting the mass. That probably in thoracic, especially lower lung location, the abdominal mass cannot dissect or override the diaphragm line. Good, and subscription. Thank you very much. Dankeschön. Let's move to left lung. What do we see with this frontal radiograph? Yes, mass on the left upper lung zone. On the lateral film, the mass margin or density is not so clear. Now we see the contrast enhancement of the tumor mass in left upper lobe at the axial contrast enhanced CT, and thin section lung window setting CT shows us many speculations with some more longer pleural text suggesting pleural invasion or the possibility of visceral pleural invasion. Ninth, somewhat simple image findings. Large mass with central gas density cavitation, separated with descending aorta margin. In the axial CAT scan, we see the mass, large mass with cavitation, probable visceral pleural invasion, even suggesting the possibility of a rib invasion. Yes, the mass is not in touch with the descending aorta. This mass is in left upper lobe location, squamous cell carcinoma. Old man's another interesting but actually terrible sad image. What do we see? What about the heart border? Left heart border. Where is the tumor location? 10th, frontal radiograph. Fist-sized mass in left lower lung zone, not in contact with heart border. That means the mass is not in frontal location, but in back location, that is left lower lobe. We can confirm it on this axial contrast enhanced CT. Fist size more than 7 cm, T4 staging tumor mass in left lower lobe. Another large mass overlapped or just behind the left heart, left ventricle, left lower lobe lung mass, lung cancer. 6 cm adenocarcinoma in left lower lobe, T3 staging, not in contact with the heart, just behind the heart in left lower lobe location. The last image, last frontal radiograph of another old man, 4 cm mass in left middle lung zone. Where is it? Left upper lobe or left lower lobe? Not in contact with heart, far from aortic border. Actually, it's not possible in this case to locate where the tumor is, where the tumor lobe is. The answer at the axial contrast enhanced CT is in left lower lobe. This man used to be called Marlboro Man. He or they used to be handsome, dandy, gentle, healthy, and strong. He is telling us, come to where the flavor is. Come to Marlboro country. Where have all the Marlboro men gone? Regrettably, they were not healthy, happy in their later life. Most of them died in lung cancer and COPD due to cigarette smoking, lifelong cigarette smoking. The name of Marlboro. Thank you for your watching. Be healthy and happy and have a good day.